Hello everybody and welcome back to my channel, and if you're new, welcome. And as you can see in the thumbnail, today I'm doing a collab that Beauty and More with Renee is hosting and invited me to do this collab with her. We're going to be talking about thyroid disease awareness, which January is Thyroid Disease Awareness Month. And although we're going to be doing a look, I'm not going to be focusing on the makeup as much as I'm going to be focusing on talking to you about my experience with thyroid disease, which my particular thyroid disease ended up being thyroid cancer, and Thyroid Cancer Awareness Month is in September. I'm going to do the color of the thyroid cancer ribbon in my makeup look. But like I said, I'm not going to be focusing on the makeup look. I'm going to be describing what happened to me. And in no way am I a medical professional. I'm not a doctor. Anything I say is not for you to follow. It's just my experience. And if my experience can help you in your journey, if you have thyroid disease or suspect you have thyroid disease, that's what the whole purpose of this collab is bringing awareness, and how sometimes thyroid disease, especially in women, is overlooked and wrote off as anxiety or depression before taking the symptoms seriously. And that's basically where I'm starting with it. All right, so the ribbon, which is in the thumbnail for thyroid cancer, is teal, pink, and purple. That's the kind of look I'm going to be doing, and I'm just going to be doing my makeup and blabbing about my experience of my journey through having thyroid disease and then going into thyroid cancer and what happened to me, how I'm doing now, and what the journey was like. Okay, so for me, I have little notes written down. I pulled out my medical records and had to look up the dates because it's been a while. So mine all started around July of 2002. At the time, I was working as a restorative CNA at a rehabilitation / nursing home. And my first experience, or what I would pinpoint the start of everything, was around in July 2002. I was at a meeting, a restorative care meeting, and I began to feel lightheaded and dizzy, shaky, heart palps, and like at first I ate that day. I ate my normal, like I always do before I go to work, and I excused myself from the meeting and went into the bathroom, and I mean, I was just freaking out. I was shaky. I felt very lightheaded. Didn't know what was happening. I came back into the meeting. I told my charge nurse that I was going to go home. Something was wrong. Felt nauseated, blah, blah, blah. So I leave. Why I even thought driving would be a good idea, but whatever. I leave. And by the time I got to my house, I felt okay. It was gone. So I ended up turning around and going back to work. So, not thinking nothing of it. A few days goes by, happens again at work. this time I don't leave. I just went into the bathroom and hid until it passed. And then in the morning, the next day in the morning, I made an appointment with my family doctor, and I went in and explained to her what was going on. So immediately she says, well, it sounded like anxiety to her. And she gave me a prescription for anxiety and depression medication. She said that most likely it's anxiety because I was working a stressful job. I was putting in a lot of hours. Whatever. So I thought, okay, that's good. So I start this anti-anxiety medication. And I'm still having the episodes, even on the medication. And I'm telling her that, so she just increases the medication. Now, at this point, we're up to September. I am having the episodes at work, but now it has resorted to I am completely fainting. Out cold. 1 minute I'm there, next minute I'm in the ambulance. I have no idea where I am. I don't remember coming to work. I get to the hospital. Of course, because of what just happened to me, I'm shaky, I'm anxious, I'm freaking out. And they give me Ativan, call my husband, and send me home because I have anxiety. And they're saying at the ER, it's probably, that was a panic attack. So I'm like, okay. So I'm listening to them and I'm following, what they're saying. So this goes on all the way to December. And I'm fainting at least once or twice a week at home. And at this point, I'm not even going to the hospital. My family's getting used to it. It's ridiculous. I was always feeling like shit. I would feel like I'd be like, like racing and then so tired. But the one thing from that July through December, I went from weighing 120 pounds, wearing size 6 pants, to 179 pounds, wearing size 18 pants. But my doctor said, that sometimes happens from the medication, the depression medication. So I go to work on New Year's Day. I did not drink New Year's Eve because I had to. Well, I don't drink, but, I had to work New Year's Day. So I usually got no warning when I was about to faint. But I'm walking down the hall, and I get this feeling, and I run over to my charge nurse, whose name was David, and I looked at him and said, it's going to happen. And he said, I face planted right at his feet. Well, when I face planted, he immediately rolled me to my side, called an ambulance, took my blood pressure, which was 68/40. And for why he even thought of it, he took my blood sugar, which was 42. So the ambulance gets there. I am so confused. Like, I come to as the ambulance is getting there, and I'm so confused. I have no idea what is going on. So I'm listening to him relay what my vitals were, and I was like panicking just over that. And for whatever reason, they didn't take me to the hospital they always take me to. They took me to a different hospital, and this is where the turning point happens. I get to that ER, and of course, you know, when your records are in the system, and the ER doctor there pulls up everything and then asks me a bunch of questions about my doctor and why I'm on such a high dose of anti-anxiety and antidepressant medicine, and says to me, change doctors, change primary care doctors and tell them you need a full workup of blood work, blah, blah, blah. Now, by the time he's talking to me, I'm okay again. There's nothing wrong with me. By the time I ride in the ambulance, I feel totally fine. They take my blood sugar. It's 80. My blood pressure is 120 over 60 something. It's perfect. So I take his advice and I prepare to switch doctors, which it took me a minute because I had to go through my insurance and get it in, through the insurance I had and get the family doctor and all that. So I get the doctor on April 14th is when I finally get all the paperwork ready, transfer everything, all my medical records. Meantime, I'm still fainting, just feeling like shit. And April 14th, I go in to see this doctor who, mind you, before I even went into the office, she ordered me blood work and asked me to please get the blood work a week before. And she wanted 3 blood works. She wanted fasting, non-fasting, and when I was feeling like I was going to faint, go get blood work. So that was something. And I was like, wow, this lady, she's really this is gonna work out. Like she knows something's up. Like a glimmer of hope, because I had been going through this for so long. I was seriously so depressed. I mean, I was seriously ready to just call it a day. But I had 4 kids at home to take care of. My mom had just become disabled and moved in with us. And I mean, it wasn't a bad disability. It was blind. It's a long story. But anyway, so I at least had her there. She was helping with the kids. It was wonderful. So I had a little bit of relief there. So I get into the doctor. I get in there. She's washing her hands. She's looking at me and she says, how long have you had thyroid disease? And how long has your neck been swollen? Which I had mentioned to my other doctor that my neck seemed thick way down here on the bottom. And I gained all that weight. And she said, oh, it's just a fat roll. I'm like, oh my God, okay, whatever. So the new doctor comes over, starts pushing around. And she said, if you're up for it, I'm calling over to the hospital, to my colleague, and see if they'd be willing to do an ultrasound on your thyroid today. And I said, I'm up for it. I'm off work. I'm totally up for it. So that's what happens. I go over, I call my husband at work. I tell him what's going on. He immediately gets off work and meets me over at the hospital. So the hospital that I went to, and I don't want to mention any names. So the hospital I went to is a teaching hospital. So I get there. They set me up for the ultrasound. Now they're ultrasounding here. So it's a little uncomfortable because you're all leaned back. And, having someone right there at your neck anyway is kind of weird. And I knew something was up. There was 2 people in there, and they said they would be right back. They left the room, and an entourage of people comes in. And I'm like, oh no, what did they see? So they're all talking amongst each other like I'm not there. They asked me if I had an endocrinologist. I said no. They asked me if I would be willing to sign on. They were already checking my insurance with an endocrinologist that taught at the hospital and also had a practice, one of the best in that county. I said, okay. And they said that they were calling him and he was going to talk to me. So he talked to me. It was so weird. So I'm laying in this ultrasound room on the phone. My husband's panicking by this point. He's pacing back and forth. And I'm talking to him on the phone, and he said, would I agree to a fine needle biopsy, that they saw a nodule on my thyroid that's very suspicious, and since I'm already there and that I'm in a stable mood, like everything is, that I feel okay right now, would I give permission to do the fine needle biopsy? So I agreed. They run in with papers and for me to sign, and they numbed my neck, and they start to do it. Was uncomfortable. I'm not gonna lie, it was very uncomfortable. It didn't hurt. It just was very weird. It's on your throat, pressure pain. I was scared to death. At this point, I'm bawling. My husband's bawling. We just don't know what's happening. And they got 6 passes, and then because they told me when I couldn't take any more to say, and then I said, that's enough. And they told me that I'll call him Dr. W, my endocrinologist, would be contacting me with the results. So I was like, okay. I went home. I went to work the next day and did fine. I told the facility what was happening, and that I would be getting a phone call within a week. They told me anywhere from 4 to 10 days. My work suggested that I take a vacation, so that's what I did. I immediately went on vacation. Now, this was April 14th, 2003. April 14th, I got the phone call from the doctor, and I told him I wasn't coming in. Just tell me on the phone what is happening. I already knew. I knew it. And he said that the biopsy was positive for papillary cancer, and that he was recommending a total thyroidectomy and then treatment after. So he gave me names of 3 surgeons. He wanted it done as soon as possible, and that my insurance covered. So I called the 3 surgeons. I chose one. I went in and got a total thyroidectomy on May 6th, 2003. I went in at 10 a.m. and I was released May 7th at noon. My scar is down in the crease of my neck. It's not really visible anymore. Unless I get a suntan, you'll see a white line. And I cover it with foundation. Of course I do. So here's my teal, pink, and purple look. All right. So after the thyroid surgery, before I was released from the hospital, and surgeon came in to remove the bandage, which was my whole neck, and exposed the scar, which was very gory looking and weird looking, and had this like clear gluish stuff on it that I was to remove on the 7th day. And then my appointment back to see him was going to be on the 19th of May, for him to do an incision check and just check me over and all that. So they released me. I was on the med called Cytomel, which I would be taking for approximately 2 weeks till my body adjusted to not having a thyroid. And then I would be getting Synthroid shortly after. So he had to inform me that my thyroid was very swollen, and he had nicked my vocal cords when removing my thyroid. He was honest about it, and I knew it was a it could happen. And he said that I would still have at this point I was not talking yet. I'm just whispering like that. That's all I could do. All they wanted to make sure is I could swallow. And my diet was soft foods for 2 weeks, like pudding consistency up to cottage cheese or tapioca consistency, nothing more. No hard foods. Like I could do rice if I could swallow it whole, but he said even that, he didn't want me doing it. So, he said my voice might just be totally normal, or it might be like this, like a whiskey voice. And this is not my voice. I used to do karaoke and sing, and I can't do that anymore. I have this lower toned voice, which was very scary hearing when you're used to hearing yourself inside your head all your life. And then when I first started talking, it was very anxiety inducing to hear that my voice had changed that drastically to me. Although I had a great support system and everybody was reassuring me everything was fine. So the next step was to get on my meds. I got all leveled out. I was feeling wonderful. I dropped all the weight. I went down to 140 from 179 by September. Now on September 5th, I did go off all my meds because now I had to do the second part of my cancer treatment. So I had to go off all my meds, which makes you feel like poop. You're so tired, you're dizzy, you're nauseated, you just feel like a big lump of crap. And on September 17th, 2003, they gave me 107 MCIs of radioactive iodine. I had to be isolated at the hospital from anywhere from 5 to 10 days. Mine was 8 until they stuck the wand up to me and I no longer registered radiation on my body. Now, when you do that, you go in and anything you take, you can't take anything of value because it's radiated and you can't bring it back out. All the clothes you go in with get thrown away. As you come out, you're being showered. You take 3 showers on your way out to get to your going home clothes to make sure that there's no, residue of radiation on you. It's a big ordeal, and it really sucked being away from my family, and it was very scary because they make you swallow a pill after they get done telling that when they walk out in hazmat suits, they have this pill in a lead cup. You are to reach in, pull it out, uncap it, put it right in your mouth, drink the water, and walk over to a different area. They wand you, and they, in hazmat suits now, rush you to the door, open the door, and whoosh, you go in, and you go through 3 doors. until you get into the room you're going to be staying in. So you just swallowed something that they needed a hazmat suit to hand you. So there's that going through your head. Very scary, but I did it. I got through it. All right, so after I get out of isolation, I get home. 4 days later, 4 days later, I have to get a scan, a total body scan. And took 45 minutes. You have to lay really still. And you wait for the results. And unfortunately, I had a piece in my chin, on this part of my neck, and at my knee that lit up. So, I go back on my meds. 1 month later, I go back off my meds. This time, my insurance will not cover me to isolate because I'm not going to get as big of a dose of radioactive iodine. They won't cover for me to isolate in the hospital. I have to isolate at home. They send a packet of what to do. My husband plasticed all the walls and floors in one of our rooms in our house with an adjoining bathroom, which he covered in plastic. Covered my car seat in plastic. Got me a steering wheel cover in plastic. I go to the hospital, same routine. They hand me the pill in the lead thing. I take the pill. They warn me to make sure it went down. I am told to go out of the hospital, out the side door, go immediately to my car, drive home, go into my isolation room, and do not come out for 10 days. Now, I bought clothing to wear for the isolation, but all the materials that I wore, which I bought at Goodwill, had to be bagged up and was not allowed to be put into the garbage because it would set off radiation detectors for 2 weeks. It had to sit in my backyard. I mean, seriously. What the F, you know? I mean, come on. I get through it. I go for another scan. It's completely clear. I'm praising the Lord. Thank you. It's clear I don't have to do this again. Go back on my medication. So that time, it really took me a little bit to get regulated on my medication. At that time, I was on Thyroid. They had removed the Cytomel out of the mix. A year later, I had to go back off my meds again, and no radiation or nothing like that, but just to get another scan to make sure everything's okay. And it was like that yearly. So I got to the 5-year mark, and all my scans were clear. Whatever was in my chin and my neck, it was gone, and my knee. And that was it for the cancer part. I've been cancer free ever since. I'm considered cured. So, and I'm trying not to make this real long, because I know you're probably bored to death. But life without a thyroid is not easy. I'm totally dependent on medication. I prefer the Synthroid over the levothyroxine, the generic version. I'm not downing them. That's what I'm on right now. But I will say they can be, that brand can be inconsistent. I have had issues with it. When I'm on the Synthroid, the name brand Synthroid, let's go with this. Like, I get up in the morning, you have to take your thyroid meds on an empty stomach. If I'm on the Synthroid and I take it, it's a smooth up. Because your thyroid controls everything. Your metabolism, your moods, everything. So the anxious feelings that you may be feeling and being treated for anxiety and depression could possibly be your thyroid. Ask for thyroid blood work and a workup. your sleepless nights, your insomnia, it could be your thyroid. If it's chronic, we're going with chronic, not just a sleepless night. I'm talking chronic. Chronic tiredness could be your thyroid when you're a woman. Chronic hyperness, like not sleeping more than 4 and 5 hours a night. One of the symptoms was when I was like one part, they said my nodule would mimic what my thyroid was doing. So sometimes I was like eating continuously, losing weight, and then not wanting to eat, just feeling tired and like I couldn't move around, sluggish and bleh, and wasn't eating and gaining weight. It controls your whole metabolism. It's also a part of your immunity. And speaking of, the radioactive iodine does destroy some of your immunity. So I had to have tighter tests done because I worked in nursing, and I did have to repeat my hepatitis B vaccine so I could go back to work. It took me quite a long time to recover from the radioactive iodine. Some people get it and boom, they're back to work in a week. I had a lot of side effects from it. At this point, I don't know if it was just from everything my body had been through in the year before until they figured out I had thyroid disease and or thyroid cancer. I'm grateful that I'm still here. I mean, to hear the word cancer just totally freaks you out. And they were like, oh, well, if you're going to get cancer, this is the one to get, da da da. Didn't make it any easier to get through. Now, eventually, I was okay. I went back to work. I was able to work 40 hours a week as usual, although my energy level has never returned to where it was before I got thyroid disease. My stamina has never returned to the level it was at 37 years old. It just never returned to that level where I was. But I was okay. I was able to function. I was able to do things with my children. You know, now being on medication, you think, okay, so now your level, you just take that and you're fine. And you are, for the most part. But seasonally, my medication changes. When I'm less active, my medication needs to go up. It goes up to 175 mcgs. During the summer, when I'm more active, it usually drops to 150 to 125 mcgs a day. Because your thyroid controls your metabolism. I don't know if it's just the way my body processes it now, why it goes up and down, but I notice seasonally when I'm less active in the winter, the medication needs to go up. When I'm more active, it needs to come down or if it don't, I go into complete hyperthyroid where I'm anxious and sweaty and eating continuously, dropping weight. Like, that's how I know it's time to go in and get my blood work. Also, when I was 48 years old, having anything to do with thyroid can cause you to go through early menopause. I went through menopause at 48. When I went through menopause, of course, your hormones are changing in your body, and women's hormones can sometimes change daily. But I went through a big change where I had to go up to 200 mcgs daily, and I was on that for quite a while, and then I started having hyper symptoms. We did a blood work, and I'm back down to 150. So that's the other thing. After you've had thyroid cancer, if that's why your thyroid was removed, they want to suppress your TSH levels, which you're always just slightly hyper. I did that for 10 years, and then I fought with my endocrinologist and said, I'm going to tell you, I want a blood work paper, and on a day that I feel my best, I'm going to go get my blood work done. And I want you to adjust my medication. So that's how, so I'm always at that level. Because after 10 years of being clear, suppressing that TSH the way they were, the most I slept was 6 hours a night from after having my thyroid removed and getting leveled out because of the fact you're slightly hyperthyroid. It also affected like my ability to tolerate heat. I mean, to cut the grass was murder. I mean, I'd be so overheated, I'd be practically having a heat stroke. So I fought with my endocrinologist and ended up switching endocrinologists. And the guy listened to me and he said, let's do it. He handed me the paper. I went off my meds for 3 days, like he suggested. On the 5th day, I started retaking them at the rate I was, because it has a 7-day half-life, so he can go by that. On the 5th day, I felt wonderful. I went in, got my blood work, and he saw the level at where I felt wonderful at, which was not very far off from where he had me. It's just that it was right at the number 1 instead of being like the -2. You'd have to know. But he allowed me to do that. And that's where my medication is now. That's where he allows me to keep my TSH. I feel wonderful. But I just have to keep an eye. And I mean, and it's important too, because like I said, the thyroid is part of your immunity. To pay attention to your immunity, take precautions. When you can, stay away from people that have flu. I mean, but your immunity will build back. Like I said, I lost my titers for the Hep B. I got revaccinated. That was fine. I actually got chicken pox from my neighbor's kid as an adult, which I had chicken pox as a child, which then prompted my immunologist to run titers to make sure that I still had immunity to measles, mumps, rubella, because I had all those as a kid. They didn't even inoculate you for that when I was a kid. I was one of the last years to get a smallpox vaccine, and I still had titers for all those. So I did get the test done, but for some reason, I got a nice dose of chickenpox as an adult. Knocked me on my ass for 6 weeks. But I got through it. And you can get through it. If you just got diagnosed with thyroid cancer or thyroid disease, and you had to have a partial thyroidectomy or a total thyroidectomy, and you're going through it, and you need to reach out in my comment section. Reach out in Renee's comment section. Hit us up on IG. My IG's listed below. DM me. I'll talk to you. I'll talk you through it. I'll listen to you. If you want to cry, you want to talk, you just want to express your fears. I've been there. I've been there where I ripped the little plastic piece I was supposed to take off 7 days after my surgery and looking at my scar, and there's a string hanging out, and going into a complete total panic mode. And then calling them, and they said, just calm down. Everything's going to be okay. It won't hurt you. Da-da-da. And going there 7 days later, and he goes up to it and goes, dink, and just pulls it out. Like, I'm like, without a warning. And then really cleaned my scar up good. And, 'cause at the surgeon, when I got my post-op, it was scary. I mean, they cut your neck open. I mean, you're freaking out, and they tell you all these things, and you sign your whole life away, not even knowing if you're going to come out of it. So I've been there, and I understand the anxiety. I mean, I was up all night the night before my surgery, and, my ex-husband, he sat up with me. I mean, he paced the floors with me while I had my meltdowns. But I made it through, and through the help of that endocrinologist that I had when introducing me to, suggested that I try Reiki, which I had done energy healing before, but not the Reiki variety. And I went to a Reiki healing session, which got me involved in learning Reiki. It really helped. Do what helps you. Do what helps you get through it. Look up everything. Research everything. Look up a good thyroid diet, like post-op thyroidectomy diet. Look up everybody's story about what it's like living without a thyroid. Get your follow-ups. Get your blood work. Get your scans. When you get the what do they call it? R1 131 radiation iodine, radioactive iodine treatment. Know you're going to be okay. I researched it. There's very few, I mean, you can get some side effects, but very few lethal or really bad side effects. You know, a lot of people just skate right through it. You know, make sure you listen to what they say. Drink your water. Um, Expect headaches after your surgery, which are horrible, and know that they're caused by tension from your neck being stretched and the way you're holding yourself because you're tense, because you're scared to move. Put a cold rag on the back of your neck. Um, reach out. Reach out to other people, and don't be afraid to call your doctor and ask questions. There's no stupid question, but just know that Renee and I have been there, and if you want to reach out, if you have a question that we can answer or help you get the answer to, well, I mean, I can only speak for myself, and I'm sure Renee feels the same way. Hit us up down in the comment section. If we know the answer, we'll tell you, and if we don't, we'll help you get the answer you need. Just know you're not in this alone. And remember, just make sure, if you're feeling something's wrong, ask for that thyroid blood workup, because it's not always in a routine blood workup from your doctor. Ask for it. Doesn't hurt to check. I mean, it affects everything. It affects your periods when you're a woman, your moods, your weight, your sleep, your energy, everything. So, with that said, I'm sorry it's 42 minutes long and I blabbed your ear off, but please leave any questions down below and go over and watch Renee's video at Beauty and oh my gosh, Beauty and More with Renee. And she's a great gal. You're gonna love her. She's beautiful, and she's just been through it. She's got the fresh scar to prove it. So, with that said, please like and subscribe. Go on over and watch Renee. And until next time, bye.